Welcome to Moments with MamasteFit, which is our podcast series where we will be discussing one case study every week from our professional experience. So we'll be sharing an experience that we had as a labor nurse, as a doula, and then we'll have some guest pellet floor PTs that come on and share some of their experiences as well. So you can learn from us either as a professional or as a parent that is getting ready to navigate this phase of life. Welcome to the first episode of Moments with MamasteFit, where we are going to be sharing a story that we have experienced as a professional and how we saw it solved or how we solved it ourselves. And so today's episode is going to be about cervical scar tissue, which is something that I think a lot of folks don't know about until they are in it, or they happen to have a provider that is well versed in it and they kind of bring it up to them. So a situation that I have been a part of a few times as a doula, and if you've been a part of it as a nurse, obviously give your input, is someone will be laboring and they will be what looks like active labor, vocalizing with their contractions, really moving with it. They're kind of in this labor land, and then they're 1 centimeter. And then they're in this active labor, they get checked again, and they're 1 centimeter, and they're 1 centimeter, and they're 1 centimeter. And it's like, what is going on? Or they're not dilated at all. And we're trying to figure out why is their labor not progressing when they're doing the movements, they're unmedicated, they look like they're in active labor, and their contractions seem very strong. And one of the things that seems to be correlated with this is cervical scar tissue. And so you can get cervical scar tissue from different cervical procedures, like pre-pregnancy. So if you had a LEAP procedure, for example. So those kinds of things can cause some scar tissue. And not all of us know about it enough to break it up. And so sometimes it can cause this, the inability of the cervix to begin to dilate and break up because that tissue is kind of keeping it closed. And so the ways that I've seen it resolved is, one, eventually it just breaks up. You continue to labor, and then the tissue breaks up on its own, and you dilate super fast, and then your baby is born very quickly from then. The other instance is what I've seen in the past 2 births that I've had where someone had cervical scar tissue, is that the provider had to manually break it up. And there's different techniques that I've seen. One, she eventually got an epidural so that the provider can use forceps to really break it up. And then another one, they just massaged it with their finger or was able to break it up manually just with a really intensive cervical exam, essentially. So both of those seem to be helpful to breaking up that scar tissue, and then we saw labor progress. But usually it was something that we didn't notice until they had been checked several times and their dilation was still 1. It was still 1. They look like they're in active labor. And so it's not always a right away, let's fix this now. It's usually after they've been laboring very intensely for several hours. And so at that point, they're getting really fatigued. Their babies are also what is going on? And so babies sometimes start getting kind of stressed out. And so if you've had some sort of cervical procedure pre-pregnancy, sometime in the past, a LEAP, you had an abnormal pap smear, for example, and they did a biopsy, it could be worth seeing if you have any sort of scar tissue, because that could impact your birth. So we actually had a birth story where somebody shared about the cervical scar tissue that was found when they were 41 weeks pregnant, trying to have a home birth, and their midwife then were able to identify it at 41 weeks when she had her first cervical exam that there was some scar tissue. And all of us are kind of we heal differently. Similarly, if you have any sort of cut on your body, some of us are more likely to develop scar tissue than others. So if you cut yourself and you develop this crazy scar from what seems not a very intense wound, or if you've had a C-section and your incision almost healed and there's a lot of scar tissue there, that could be an indicator that maybe you are just that person that develops scar tissue more easily than other people do. And so any procedure that's on the cervix does increase the likelihood of having scar tissue on the cervix, but sometimes it just develops and you've had nothing done on your cervix whatsoever. But the common ones are any sort of biopsy of the cervix. So it's called a colposcopy, where they look at the cervix closer on a microscope, and then they kind of take some of it to then send a larger sample than a pap smear. Or a LEAP procedure, and this is where they literally carve out a portion of the cervix that has some indicators of cervical cancer, which is beneficial thing if you do have cervical cancer to kind of scrape it out, but that can affect the cervix with either developing scar tissue that could affect its ability to open, but also it could actually affect the ability and increase your likelihood of having preterm labor as well, because you're taking some of the cervix that is keeping your baby inside. So there are different things, and they should go over these things when you get a informed consent before getting the procedure that this is a risk. But I do find that not a lot of providers know what scar tissue is, or maybe even believe what to do, and then be able to identify it and address it with some massage. Or sometimes I do find that a lot of the time it does just break up on its own eventually, but it's just that early dilation takes a lot longer. But when you check the cervix and feel it, you can notice it's not like the whole cervix is hard. It's almost like some of it seems harder than the other. And that is again, that scar tissue feels different than a normal cervix would feel throughout the laboring process, because it should be getting softer throughout. And then almost like gummy bear consistency maybe at the beginning, and then just softer and softer to where it's paper thin. But if there is some scar tissue, it will feel different. I can't find a word to describe it, as with many things. And I feel like the birth world, amniotic fluid, for once, I can't find a word to describe the smell, but it's a very distinct smell. When you check a cervix that I feel has some scar tissue, it's definitely distinctly different than a normal cervix throughout the laboring process. And again, you can get it massaged to help break it up, and that can help, but it also sometimes just breaks up on its own. But if you think about scar tissue needing to be broken up by your baby, that is why it's usually a little bit uncomfortable. And that's why that early part of labor, it will feel like active labor, because that scar tissue is being broken up as well. So you technically could still be in active labor because your cervix just doesn't match your labor, but it could just be that early labor is more intense because of the scar tissue being broken up. I've seen both. I feel like the clients that I've had were in active labor. Their dilation did not match, but they had the oxytocin levels to be in active labor, but the cervix just was struggling to dilate. And then we were actually starting to see issues with baby's heart rate, because we have these really strong contractions, but there's no change in the dilation. So baby's not having a really hard time to move through the pelvis because that scar tissue. And so in both those instances, the provider had to manually break it up. In other instances, I've seen it just kind of break up on its own. It takes a long time to dilate, and then all of a sudden it dilates really quickly, which I think might have been potentially what happened during my first labor. Was I was kind of stuck at 2 for a really long time. I've had some cervical procedures done in the past from some abnormal pap smears. And then all of a sudden I was complete, within 2 hours. Once I think things really broke up in there. Or it could have just been the way that I normally labor as well. So no one said that I had scar tissue, but it was kind of something that I thought about maybe had happened, and why I was kind of stuck at this dilation.
And I
in
remember
what felt like very
mentioning
active labor. Yeah. And so things that I did during that pregnancy that I think potentially helped, and this is all theoretical. I don't actually know if I had scar tissue, but in my mind, this makes sense. And so take it or leave it. Something that I did towards the end of my pregnancy was I was using evening primrose oil, in an attempt to try to help my cervix be ready for labor. I still went into labor at 41 weeks, but the evening primrose oil helps to thin things. And so I think that if there was scar tissue there, the evening primrose oil helped to kind of soften it and help it be more easily to break up. So that way, when I did begin to dilate, the scar tissue just broke up. Again, I don't actually know if I had scar tissue. This is my theory, because I was stuck at 2 in what felt like very intense contractions for a long period of time. And then all of a sudden I was complete after getting an epidural and relaxing. But I sometimes think that maybe it was because of the scar tissue. And I think the evening primrose oil potentially could have been something that helped that tissue get thinner and break up so that it can do it on its own. This is completely a theory of mine.
Yeah.
It's not based on any specific studies by any means, but evening primrose oil has been shown to kind of thin and soften the cervix and to soften scar tissue as well. So it could be something to explore if you've had some sort of cervical procedure in the past. Maybe your provider can assess whether or not you have scar tissue. I don't know, at what point a provider would be able to feel that. Is it something that you can't feel until they're in labor? Or is it something that you can identify prenatally? Like potentially, like if you notice it during pregnancy, maybe towards the end of your pregnancy, like the last few weeks, you and your provider can have a conversation on, should I try to do something to help soften this tissue with like the evening primrose oil? Or is there another recommendation that you have? Like if I'm in labor and it feels like I'm active, but maybe I'm not dilating because of the scar tissue, like what would you recommend? Could be some good conversations to have towards the end of your pregnancy, because I have seen it impact births.
Yeah. And I agree. It definitely can impact the birth, but not just like labor, because again, it could have helped you go into labor if you did have scar tissue by breaking up some of it, but maybe like the rest was just like still there in the cervix, because the cervix is about 3 centimeters long, which it's pretty long. You can only reach so much from the outside, to like just the top layer. So you're breaking up the scar tissue at the top, but like there could be more further down. So like it helps you get into labor because it broke up at the top layer, but maybe throughout the laboring process, you still got to get it at the bottom layer. So the one birth story that we had that shared about it, her providers did do cervical massage to kind of help break up some of it, to kind of help her get through labor. And then they also did evening primrose oil. So evening primrose oil can definitely help thin stuff out. It's like a thinning agent for like other things. So you place it vaginally, and then the oil will just, like the capsule just dissolves and it kind of does its work on the cervix. Some people will say take it orally. I don't really know if that does anything. I don't think research supports that it does anything for the cervix if you take it orally, but at least applying it vaginally. And then also when you do that, trying to massage the cervix at the same time can kind of help break up that scar tissue. Massage in general can kind of just help break up scar tissue, especially like the cervix is only like that big, which is kind of crazy to think about. It's a tiny little donut. So evening primrose oil could definitely help break it up along with massage. But again, you might not know that you have it, because again, the top of your cervix could feel fine. And it's just during labor that you notice it. And like that evening primrose oil, I don't really know if it's going to be able to get into that bottom portion of the cervix, because it would have to get through your like mucus plug. But something that could help that I think seems to also make sense in my mind are mechanical dilators. So something that they could do, obviously they can do like membrane stripping to kind of see if they can, during that could massage it and break it up a little bit. So the evening primrose oil can kind of help thin it out and break it up a little bit, massage. But a Foley bulb kind of does the massage for you, where you're inserting the bulb through the cervix. So it does have to be somewhat dilated. That is like the one downside of mechanical dilators. You need to be at least like 0.5 centimeter dilated, 0.5 centimeters, fingertip, or some people will call it, to be able to get the Foley bulb through. And just that act of like pushing it through can sometimes help break it up a little bit. And then they blow up either one balloon inside the uterus and apply pressure onto the cervix from the inside, or it's a Cook catheter where it's 2 balloons squishing it together. The 2 squishing together might be a little bit more helpful for scar tissue depending on where it is, but just the inside too, especially if that scar tissue is really just on the inside of the cervix, could help kind of break it up. Especially, not everybody will do it, but some nurses will just place it and leave it. And studies do support that is an effective way to use a Foley bulb. But if there is scar tissue going in and like taking the Foley bulb, which does not feel great, I'm going to preface that. But if there's something holding your baby in and you want to break it up, this could be effective. Put the Foley bulb in and then occasionally just like twirl it around. And that's helping like
that sounds
break
horrible,
up. Yeah, it doesn't feel
it
great.
makes sense.
But if there is scar tissue, that can help, again, break that scar tissue up. And once that Foley bulb comes out and there was scar tissue holding your baby in potentially and not allowing it to dilate, that can be really helpful. Again, sometimes you need to do none of these things and it'll just break up. The labor will probably be a little bit longer than maybe it would have been without that scar tissue, but sometimes nature will run its course and break it up on its own.
So how do you know that this should be a concern of yours? Because obviously, like, you can see that it could cause some issues with labor progress. If you've had any sort of cervical procedure done, there's a potential that you could have scar tissue, and it could be a great conversation to have with your provider. Hey, I've had a LEEP procedure. I had this procedure done to my cervix. What should we be doing during my pregnancy to help kind of reduce the number of scar tissue that I may have? How can we assess to see if I have any? Like, let's have a conversation prenatally. And then when you're in labor, if you kind of have in the back of your mind, like, okay, I have had a cervical procedure. We haven't identified scar tissue yet, or it hasn't been assessed at all. and I'm kind of stuck at this dilation. I feel like I'm a lot further along than I seem to be dilation-wise. That could also be related to scar tissue, and it could be worth your provider kind of doing an assessment at that point to see, okay, am I feeling scar tissue? What steps can we take to help break it up? Because it doesn't seem to be breaking up on its own. And so they can do mechanical dilators. They can use like these little forceps to just break it up. They can try to massage it manually with their fingers. And so there's different things that we can do to help break up that scar tissue. And then usually after it's broken up, things dilate pretty quickly, because typically what I've seen is folks are in active labor, but they're stuck at a dilation that doesn't match where they should be. And so once that scar tissue breaks up, cervix dilates very quickly from there, and they kind of match where they have been. And then usually things progress pretty quickly from there.
Yeah, baby's born usually soon.
And so again, if you've had any sort of cervical procedure done pre-pregnancy, it could be worth having a conversation with your provider about what should we do during my pregnancy to reduce the number of scar tissue that I may or may not have. And then what can we do during labor if we're noticing that maybe there's an issue that is going on where I feel like I'm in tons of labor, my dilation does not match that. I've been kind of stuck at 1 centimeter or no centimeters for a really long time. Like, what steps can we take so that we have those plan of action established so that we can navigate these situations a little bit more? And it can also be really beneficial for our birth workers, so our labor nurses, our doulas, our medical professionals, to understand how scar tissue can impact somebody's labor. And so if you have a patient or a client that's seemingly stuck at a really small dilation, and you may or may not know that they have had something in the past, like, it could be worth asking, hey, have you ever had any sort of cervical procedure? Like, they don't have to go into detail if they don't want to, but they can say yes or no. And if they say yes, okay, well, maybe these are some steps, or maybe we need to assess for scar tissue. And so this can kind of give you a plan of action on what to do if somebody seems to be kind of stuck at a certain dilation.
And there are so many things other than just like a LEEP procedure or colposcopy biopsy that could have caused like literally any trauma to the cervix could as well. So if you had a cervical laceration in previous births, or even an IUD placement, especially if it was like a pretty like rough IUD placement, it potentially could have developed some scar tissue. Like anything that kind of manipulates the cervix. Some people, it even just from a pap smear, especially if you're very sensitive to developing scar tissue. So it could, like, you could have it and I've had none of these things, but if there is an issue where like you are just the same dilation, even if you've never had anything done, have them look during labor if you want and see if maybe there is something that's just like holding that baby.
So thanks for listening to Moments with MamasteFit. If there are specific questions that you have that you've been wondering about from your own specific labor experiences or your professional experiences, feel free to comment on the YouTube video or send us a DM on Instagram and let us know what your situation was, and we can do an episode all about it. We'll be sharing about our professional expertise as a doula and a labor nurse, and then we'll also have our pellet floor physical therapists come on to share some of their case studies that they've noticed with their patients, so that you can learn more both as the person that is going through this experience and the person that is supporting this experience. If you want to learn more from us, check out our online prenatal fitness programs and childbirth education course, where we give you a step-by-step guide on how to confidently move throughout your pregnancy and prepare for your birth. If you're postpartum, check out our postpartum education course and postpartum fitness programs to, again, help you feel confident as you navigate motherhood so that you can return to fitness and meet the demands of motherhood. You can check out all of our courses on our website at MamasteFit.com and use code MOMENT10 to get 10% off any of our online offerings.